Hi, welcome to Let's Talk Careers. I'm your host, Lisa Bauman. Today I'm talking with Melanie Levesque. She is the professor and coordinator for the massage therapy program here at Conestoga. Over her career as a massage therapist, she furthered her education by pursuing a bachelor's degree and 2 master's degrees so that she could pursue her passion in educating future massage therapists. I hope you enjoy. So welcome, Melanie.
Thank you.
I'm so glad that you're here today.
Thank you.
I'm going to get you to begin by introducing yourself and also saying your current role and something that you're really passionate about.
Sure. My name is Melanie Levesque, and I'm currently the program coordinator and professor for the massage therapy program here at Conestoga College.
Yeah, that's awesome.
Thank you. I'm very passionate about healthcare and specifically massage therapy.
Awesome. That's why you're in the field.
Perfect field.
Yeah. So let's go to the early days. How did you get into this field? Even early days, like maybe you were growing up, what was that first job or, kind of graduating, post-secondary or even high school? What did you do?
Yeah. So my very first job was working for the Canadian Automobile Association, CAA.
Okay.
And it was a great first job. I started that in high school.
What did you do, like reception or customer service?
I worked in member services. Okay. I actually started stuffing envelopes. Cool. So that was my first job. And then I started working in roadside assistance. So I would take calls in the call center from distressed motorists. Okay. And it was a great paying job at the time. And so I thought after high school, I would take a year off because I was really not sure what I wanted to do. Okay. My mother was not impressed. She's like, oh, you're going to get used to that money and then you're never going to go back to school. And it actually had the opposite effect. So if you can imagine what you might be like as a distressed motorist, we're not our best selves. And so taking those calls day after day, it became too much. And I realized I wanted a career. So I applied to a variety of colleges, variety of programs. And when it came down to making my decision, it was between nursing at Conestoga, computer sciences at Conestoga, which would not have jived because my technical expertise is turning on a computer and turning it off. That's my skill set. And massage therapy, which was in Toronto.
Okay.
And so I ultimately picked massage therapy because I wanted to move to Toronto.
So I was going to ask you, that is a very wide set of choices between nursing, computers, and massage therapy.
Yes.
Sort of as you were thinking about, do you remember as you were thinking about each of those programs, what was your strategy? Was it just apply and see what happens?
It was just apply based on what titles I was familiar with.
Okay.
So I knew what a nurse did.
Right.
I knew what computer sciences entailed.
Yeah.
Massage therapy, I honestly don't remember what it was that drew me to that because I had never had a massage. I didn't know any massage therapists. Okay. So there was nothing other than the appeal of moving to Toronto. And it was not nice. It was in East Toronto.
Okay.
I mean, nothing against that part of the city, but it's not Kitchener.
No, it's not Kitchener.
It's not Kitchener.
No. Can I ask about what year, what decade was this? Like in the 90s? Was this in the 2000s?
It was it would have been the 2000s.
Okay.
Yeah. So I graduated in 2003 from the 3-year massage therapy program at Centennial College.
Okay. So so Scarborough.
Yes.
Yeah. Okay. All right.
East Toronto.
Gotcha. Interesting.
It was definitely a culture shock.
Yeah.
And my job while I was working in college was at Danny Leather.
Okay.
And it was at a really busy and crime in an area. So
Right.
I won't say the area, but
okay. I think I might know.
Yeah, for sure. Very close to the college.
Gotcha.
And the amount of times the store was robbed.
Oh my
Yeah, it
gosh.
was very different. It was a very different experience.
Yeah.
Very different experience for sure.
Yeah. Okay, so you graduate from massage therapy.
Yes.
From Centennial College.
Yes.
What happened next?
So upon graduation, it's required that you write a registration exam.
Yeah.
And so luckily I didn't have to wait too long to write that exam. There's two components to it. So a written component and a practical component. And I did that probably the following month. So May 2003. And just a very nerve-wracking experience. I didn't think that I had passed. Back in the day, you had to wait to receive results by mail.
Right.
So just waiting for the mail to come. Yeah. And then you receive and it's like, oh, it might be too thin to be a pass. But anyways, all well and good, passed. And so I started practicing in June of 2003. And I can't remember. I've worked in a variety of settings. So I'm trying to go back. My first job as a massage therapist was actually in private practice.
Okay.
For me, that wasn't a good start because I started my career in isolation. So I didn't get the opportunity to work with other therapists and maybe refine some of my skills, learn how to talk differently or better, just to do things better. And so that wasn't a great experience, but it was a wonderful learning experience. Okay. And so after that lasted probably a year. And then I started working in a spa. And I loved it. I loved working with the people. The clients were great. The discounts were wonderful.
Nice. Where was this?
So this is in Waterloo.
Okay. So you came back to Waterloo?
Yeah. So I did come back to Waterloo. I couldn't wait to come back.
Yeah.
And then I've just worked in a variety of clinics, worked in different spas. And it was, while I was in school though, I knew that I wanted to do something more in terms of education, but I wasn't sure what. So during my entire time practicing, I was just keeping my eye out for what really interested me. And so I finally decided it would have been 2007 that I was going to go back to school and get my degree in health sciences at U of W.
Nice.
So I did that.
Okay. So you balanced, how did you do that? Did you balance working and going back to school?
I did. So I worked, and working full-time as a massage therapist is not like a 40-hour work week. So for me, it was probably handling a client load of maybe 20 to 23 clients a week. So it was still very manageable to handle that and balance university. And because I had some transfer credits from college, I was able to have a bit of a lighter workload. And so I graduated from University of Waterloo with a health sciences degree and specialized in gerontology. But even then I was like, there's just something more that I wanted. And I became really interested in the research component and the statistics. And so after graduating from University of Waterloo, I did a postgrad at Georgian College for research analysis. And so again, still working, going to school in Barrie now.
Yep.
Again, once I graduated, couldn't wait to come back to Kitchener-Waterloo. Yep. And I was fortunate. I found my own internship at Grand River Hospital. Okay. And so the department that I was working in was decision support. And so this was running stats for the hospital, basically. So being able to provide information so they can make evidence-based decisions. Yeah. I loved it. I did that for 5 years. Towards the end, I did take a secondment and I worked in the marketing department. sometime in between then, though, I realized that I did want to go back to school. And so I did. Yeah.
Okay.
I went to Laurier
Nice.
and did my master's of business administration.
Nice.
So I'm doing that, working, and still all this time, still managing my practice. So I scaled back my massage practice, but still was practicing. I've always practiced at some capacity.
Yep.
And then had a baby.
Yep.
Well, I got married, had a baby. That was all in one weekend, actually. That's a whole other story.
Okay. Maybe one day we'll talk about that one too.
I'm very efficient with my time.
Excellent. I love it.
Yeah. So during my mat leave, I just had some time to reflect and thought that I wanted something different. Okay. And I wanted to use that master's degree in a different capacity. And I came across a job posting for, I think it was called at the time, Supervisor of Interprofessional Resources at Conestoga.
Okay.
And I thought, oh, okay, well, this is interesting.
Yeah.
And
what is that?
It was this very interesting position. It was a newly created position. So a lot of it was open to interpretation and being able to mold that position into what I felt necessary. And so one of the things that appealed to me was the education component. So I taught part-time during my practicing years at a private career college. Okay. And so there was that appeal. And so long story short, the hiring manager was Dr. Paul Finch, who was the chair at the time. And one of his passions is massage therapy research.
Really?
So
I had no idea.
Yes.
I really, he's such a lovely person.
He's a lovely, brilliant, intelligent man. And he was my mentor for so long. Yeah. And so I had read some of his research papers because research is a component of the massage therapy curriculum. So being in an interview with someone that you've read their papers.
Wow. Wow.
It was really hard to just manage those emotions.
Yes.
But I was a successful candidate for the job. We got to work together, and it was just one day, it was like, you know what? We do need a massage therapy program. And he had already been thinking about this. And so we just put the paper down and just fleshed out a lot of what this would look like, and really being able to put our minds together and think about what would this massage therapy program look like
here at the college. Yeah.
Here at Conestoga.
Yeah. Now I remember this because I heard about that program when I was a curriculum consultant here at the college.
Okay. Yeah.
Now that goes back, oh my gosh, I can't, it's definitely pre-pandemic.
Yes.
Definitely
yes,
pre-pandemic.
Yes.
Because I remember, you know, my manager saying, oh, this program is, you know, something that is kind of in the works, right? It would have been in the works for a really long time.
Very long time, Lisa. It was a very long time. So we started those conversations in 2017.
Okay. I was going to say, so that's sort of ringing the bell.
Yes.
For me. Yeah.
Yeah. So 2017, we were hoping that we'd go live in fall of 2019.
Okay.
However, as you can appreciate, space is always a challenge at Conestoga. So there was just no space for the program. And we had a very specific, maybe grandiose idea of how we wanted our labs to look.
Sure, yeah. Of
so
course.
we wanted 3,500 square feet, and that's not something that you can just find laying around. So unfortunately, 2019 came and went. Unfortunately, the pandemic then.
Yeah, I was going to say.
Came afterwards.
Within 6 months, we were into the pandemic.
Yes, deep into the pandemic. Yeah. So other areas took a priority at the college, but it presented an opportunity. The pandemic provided an opportunity because a lot of programs then went remote. And so with these programs that went remotely and successfully, all of a sudden there was space available. So we were able to launch in fall of 2022. And we took a risk because we didn't have the space per se. We had the space in agreement in theory, but we did take a risk because we didn't have the space actually physically built. And so there was different ideas of where we should put our lab. And we had this idea of what it would look like. And we had the blueprint and we had an idea of how much square footage, and we weren't backing down. We're like, no, this is approximately the square footage we want. Okay. And so it was really just happenstance and having a great chair. So currently our chair is Diana Fungley, and she was strong advocate, still is a strong advocate for the program, really believed in it, saw that we had a lot of work done. The curriculum had already gone through all the checks and balances. It had been approved by the ministry. So it was just the space.
So describe the space for me then. What was
goodness.
the dream, and then what did you get?
Yeah. So it was a lot of managing expectations.
Okay.
So our space really was in our minds going to be a 2-lab space. So we'd have 2 labs, we'd have our own classroom. And so we'd gone through a series of different spaces. One of them would have been in the F wing. We knew that we wanted to stay at Doon. Yeah. And so one of the spaces was in the F wing, so the newer area of the college. But we would have scaled back a lot. So that didn't work because it was actually nursing space, and they don't have enough space now. So they're not going to, they weren't keen to give up any space that they really needed. I think there was talks in the E wing. There was even a talk about Milton. Okay. Which I was less than enthusiastic about. Sure. So the Milton space, I was less than enthusiastic. So when that didn't materialize, I was secretly happy. Yep. And then all of a sudden there was talk about President Tibbetts is moving out of the ESB. So the building formerly known as the Employee Services Building. Okay. And all of a sudden it was like, we can make this work.
Nice.
And so I knew not to get my hopes up. Okay. I knew not to get my hopes up. So I've seen a lot of HGTV, and I was like, you know what? I'll just wait. I'm just going to wait this out.
Yep. See what happens.
We'll just see what happens. And so things just kept on moving, and there was no stopping. There was no barriers. It was just like, okay, what space do you want? Okay, well, what would that look like? It was all of a sudden, all of our asks were being heard, and it wasn't just being entertained. It was this serious, like, okay, that could work. And it was really exciting. So the original design was actually put together. My husband is a store planner. So he's got all those programs, and, this is the space. So he's doing measurements. And despite my father being a design engineer, I can't read a blueprint to save my life. I have a hard time conceptualizing. So I am putting my trust in these designs. I'm like, it looks good. I guess it looks like it fits. So in terms of what we wanted and in terms of what we got, we're actually aligned. Okay. So our current space, which we will be moving into in a couple weeks. So during Student Success Week, actually, we'll be moving in, doing the unpacking, and we have this beautiful space in the building formerly known as the Employee Services Building. And it has a beautiful reception area because we have a public facing clinic. Yes. So our student therapists will treat members of the public. Nice.
Ooh, I'm so excited for you.
I am so excited. We have, and I don't want to say this too loud, but we have storage. So that's a premium at Conestoga.
Yes, it is. Storage.
So we have our own little storage. We won't talk about that. I don't want anyone taking our storage away. And then we have our 2 labs. So we have a 2 10-bed lab.
Okay, cool.
And so that allows us to run more cohorts, more classes. Yep. We can have 2 clinics at the same time. Yes. We do have the classroom that we will be using. Will obviously still be a part of the larger college because we can't just survive on one classroom. Yep. But our students have areas where they can just relax and do some work and think about their charting and do their charting. And so when I saw it, again, I have a hard time conceptualizing, but being able to, they have so many new programs where you don't have to now just conceptualize. You can kind of see what the color schemes look like in the flooring. And so being able to go through it, I went through it a couple weeks ago, and it was just like, it was actually emotional to see it.
Yeah.
So I affectionately refer to it as my third child, because it's been this labor of love.
Yeah.
So yeah, we're really excited to move in.
That is really cool.
Mm-hmm.
There's something that's happened here though, in your career, because you were in what did you call it?
Interprofessional resources.
Okay.
So I was there.
Yeah.
And then where you and I crossed paths, actually, I was in my role as the associate registrar.
That's what I want to know.
Yes.
So what happened between there to now?
Yes. So I'm the type of person that's very open to opportunities, open to whatever. And having worked in the interprofessional area for, at that time, would have been 5 years, I knew I wanted to change. And so I had mentioned that I had done my business degree, and I really wanted to use that now. And so an opportunity came up. It was just before the pandemic, actually. The posting for associate registrar, student financial services. It was posted, and I had interviewed for it. And no, I had not. I'm trying to remember if I'd interviewed, because I remember the interview was remote. So it must have been afterwards. At some point anyways, they had paused all hiring.
Right. Yes, I remember that.
So I was a little disheartened, but then after, however, like, it all just seems like a dream, a bad dream, thinking back to COVID. But at some point there was an interview and another interview, and then I was the successful candidate, and I am now running a $7 multi-million cost center department that I really did not know a lot about.
Okay.
Very scary, but at the same time, there was something that just really drew me this year. It really did.
Okay.
And I found out a lot about myself. I really enjoy structure, compliance, legislation, and I like to have a box. I'll color in that box. So that department really fed that for me. And it was the most, to date, one of the most, I learned so much in that department. Yeah. And I learned so much about the college in that department, because the registrar's office is the heartbeat of the organization. Yeah. So I had a really good appreciation for how the organization ran, and just things that I'd never even thought of. Right. Met a lot of really great people like yourself. It was this really good opportunity during that time.
So how long were you in that position then for?
It was just over 2 years. Okay. Just over 2 years.
Until the massage therapy opportunity came along.
Yes, exactly. Okay. So during all that, I had also recognized that my mentor actually helped me to recognize that one of the areas that would help me to be successful, recognizing that we are still going forward with this program, is degree in education. So some formalized education. Right. So I was teaching part-time, massaging part-time, working full-time, and then doing this second master's degree in education. Okay. And so when the opportunity for the program coordinator position came up, I left nothing to chance. I was taking every opportunity I could to learn the college, learn about adult education, curriculum. I became an accreditation surveyor for massage therapy education. I wanted to have an understanding of everying I could.
You just dig right in.
All in. Just all in.
Yeah, that's awesome.
All in. Yes.
So you mentioned you had a mentor.
Yes.
Tell me a little bit about that. Like, when did you meet this mentor? What does that look like?
So it is Dr. Paul Finch. Okay. I don't know if he wanted that role, but
okay. You're going to be my mentor.
Yes. Yeah. So I just treated him as such. Right. And he would give me advice, and he really helped me to put my grandiose ideas into a plan, an actionable plan. And so to have these goals and these steps, and to have someone to ask these questions and just to see how he does things.
Yeah.
I still think now, whenever I'm at a crossroads, I'm like, what would Paul do?
Okay. Nice. Do you still get a chance to meet with him?
I do.
That's wonderful.
I do.
Yeah.
For
How
sure.
often? I'm curious.
Not as often as I'd like.
Yeah.
He's since retired, so
Yeah.
I try to respect
Of course.
that. But at the same time, he's always open for a conversation. And I just love the way his brain works, where he sees the big picture and then he's able to come back to that area where you need to zoom into. And so he's great at helping me to think holistically and big picture. So anytime I have a question or I'm not sure about something, he's always there. He's always there.
Yeah, that's really cool.
Mm-hmm.
So how would you describe your choice in going into massage therapy as a career? Because you sort of started out with saying, I actually had no idea, but all of a sudden I'm going to Centennial College and becoming a massage therapist.
Yes.
Yeah. Tell me a little bit more about sort of how would you choose the industry?
I will start by saying I love what I do.
Yeah.
I absolutely love what I do. It's a perfect career for me. There's so much gratification. There's so much flexibility. And I've been practicing for 21 years, but I still feel like it's something that it's new. Right? There's new modalities. There's new ways of treating clients or patients. So I love what I do. Having said that, I would not recommend that somebody chooses their career based on geographical location to party.
Okay.
It worked for me. It worked for me.
Yep.
But I'm not sure that's the best choice. I do know people that have chosen their careers similarly.
Okay.
Doesn't always work out.
Yeah, we call that happenstance theory.
That's exactly what
that's
exactly it. That's exactly it. And now that I'm an educator in the massage therapy program, I really advocate for people to do their research before getting into the profession, because it is a regulated health profession. And with that comes a lot of responsibility. And I find that oftentimes individuals who are interested in massage therapy are not aware of just how much rigor there is and how much science there is within the program. And I do believe to be successful, to set yourself up for success is just understanding what you're about to get yourself into. And it's I would say, deceivingly challenging program.
Right. Yeah.
Mm-hmm.
Yeah. What, so you talked a little bit about sort of new modalities or sort of new things. I was going to say, where do you sort of see the future of the industry going? Like, what do you see if people were to get into us? What are some of the things that they might want to know, that they might think about? Oh, it's just like this, but actually, as you kind of go, you unpeel a layer, it goes deeper, right?
For sure. So there's so many areas that you can choose to focus on as a massage therapist, from pediatrics to palliative to orthopedics, sports. There's so many areas. And so once you graduate from our program or any massage program, you are more than qualified to treat all those populations as a general practitioner. So you might choose to focus more in an area. And in terms of trends, like, there's so many different and underutilized areas. For example, in cancer care, massage therapy is very effective, especially with the swelling that you may be familiar with that accompanies a lot of conditions or post-surgical conditions. And so the lymphatic system, which facilitates removing that waste, it's compromised. Massage therapy is this wonderful, non-invasive therapy that can reduce that. However, there's not a lot of trained therapists in this area. So definitely being able to educate more massage therapists in this area is great for our healthcare system. And again, it's a nice way to introduce positive touch. Oftentimes, individuals who have gone through medical procedures, they have so much now negative associations with touch. They have experiences where things are being done to them, whereas massage therapy is this collaborative experience where we're working together and we're able to reintroduce positive touch to them.
Yeah. Yeah. And then what about the different, I guess you'd have, if you were to think about this industry, you could go into so many different fields like private, spa. Maybe you could talk a little bit more about all those different options for folks, right? Thinking about that.
Yes. So yes, there's even more thinking about like travel or working on a cruise ship. There's so many opportunities. Yeah. And so I always say it's great to start out and maybe do a few. You can do a few at a time. And I find every time I change locations, it's like having a new career again.
That's amazing.
And so it really is personal preference, being able to think about what kind of schedule you want and how much autonomy you want. And obviously private practice gives you the most opportunity for flexibility and autonomy. There's also more responsibility, so it's not for everybody. But there's also self-employment, working with a chiropractor, physiotherapist, or other health professionals. So it really is individual choice, but just being able to know what works best for you and recognizing that after 3 years, you've put in a lot of investment into your schooling and your career. So make sure that you find whatever environment that's consistent with your values and your desires and your goals and allows you to come to work as your best self.
What would you, if somebody was thinking about getting into this field, what would you suggest them to do to kind of like, I don't know, try it out or get into it? Or I think one of the best things is being able to experience the massage as a consumer. Right.
So whether it's a positive or a negative experience, it will help to inform you if it's something that you can see yourself doing.
And how easy is that? Go get a massage.
Right. I say that. I'm like, my homework for you is to go and get a massage.
Sounds fabulous.
Right. And so I think it's the best way. And you can go to a spa or those different environments that we talked about, or come to our public clinic and receive a massage from one of our student therapists that can really tell you what it's like to be in the trenches of the schooling system. Yeah. But being informed is your best bet for sure. Again, it is a very deceivingly challenging program. So making sure that you're ready for that, making sure that you're able to set aside the time to study. And it's, the curriculum is very intense. And we also expect our students to be doing a lot of work on their own in terms of studying and preparing. So it's not just classroom hours. And I feel like prospective students, they focus on that. And a question that I guess get asked a lot is, what does the timetable look like? Right. And I'm like, well, this is how many hours you'll be in class. But for each of those hours, especially anatomy, you should be spending 3 hours to that 1 hour. Yeah. So being able to allocate sufficient time to be successful.
Yeah, for sure. So thinking about your career, you sort of start out in massage, you're doing some practice, you kind of go off in these other little segues and then you kind of come back.
Yes.
How would you sort of, as you kind of reflect on that, how would you describe maybe the pros and cons of those types of choices and where you are today?
I'd say the pros, when I reflect back, is just how each of those experiences have allowed me to be successful in my current role. And so whether it was working in decision support and being able to critically evaluate information, learning how to be more assertive. I tend to be a more quiet person. And so being able to speak with executives and senior leadership, that's really helped me to break out of my shell. But being reflective. So reflective practice is one of the things that we educate our students on, because you need to be able to self-assess at any time. And so I do a lot of that, not just in my massage practice, but whatever role I'm in, so that I can take those skills and transfer them to whatever I'm currently doing. So that would be a pro. I'm very open to ideas. So whenever something happens, I'm open to it and I'll delve in. One of the things, though, that I feel that I regret is I didn't live in the moment.
Okay.
And so I'm very goal oriented.
Yeah.
And so I'm very focused on that end goal. And I don't feel like I always enjoyed those experiences along the way or celebrated those smaller milestones.
Okay.
And I find even that is something that I bring to my teaching practice.
Right.
So celebrating milestones. When you and I met, that's what we're doing. We're celebrating halfway there for our students that we're halfway through the 3-year program.
Yeah. Beautiful.
And so I'm constantly reminding them, okay, you've just finished your midterms. Like that's huge.
It is huge.
Right? You're huge. So just reminding them to be present in the moment, encouraging them to have those interests still outside of the classroom, reminding them what is your why. You might be here for your daughter, your partner, whatever it is, but remembering to reinvest in those relationships because that's why you're here.
Yeah, for sure. Yeah. That actually leads me to my next question, which would be, how would you describe the stage of your career that you're in now?
I don't know how to describe it other than I feel blessed. I love what I do. I wake up in the morning feeling grateful. I feel that I have, although my husband probably wouldn't agree, that I do have some semblance of work-life balance, but I genuinely love what I do. I get to still practice. I get to work with students, and I feel like my role is to facilitate their learning journey, their academic journey, and just being able to be a part of that it's so amazing. To have a direct influence on the curriculum and just seeing it materialize. It's absolutely amazing.
Yeah, definitely. What's next for you?
Oh my goodness. That's a great question. Yeah. In terms of next, I'm looking at our curriculum and always trying to find out different ways to engage students. Right. And so right now it's being able to be proactive and looking ahead at how we can do a better job of engaging and making sure that our students are prepared for their registration exams. Looking at how I can integrate modalities into our teaching curriculum so that we can have our best graduates. So I'm really dedicated to the cause. Amazing. And any opportunity that I have that I can glean insights. Yeah. Is something that I just want to pour my heart into. Yeah. This program is, like I said, it's my third child. So awesome. I look forward to seeing it continue to grow.
Yeah. What advice do you have for students?
My advice for students is to be informed, be open, and being able to be in the moment. And so all of my in-person classes, I start with guided meditation. And I encourage them to forget about what came before and what's coming next, but let's just be present. Let's be together. Let's learn together. It's certainly, I learn from them and I'm hoping they learn from me as well. But being present in the moment, taking as much as you can from this academic experience, and don't take it for granted. Right. So being able to celebrate those milestones, recognizing that there's opportunities to enjoy the steps along while you are progressing and not just thinking about that final goal.
Yeah, for sure. That's awesome. This has been a lovely conversation.
Thank you.
I'm so glad you came.
Thank you for having me. I really appreciate it.
Wow, what a great conversation. Thank you for listening to this episode of Let's Talk Careers. If you liked this episode and want to hear more, follow us on Spotify and subscribe on YouTube. See you in the next one.